Well, I wish you all a wonderful time and I welcome you all to Anatomy of Head and Neck now. And before I start this, I want to say thank you to my teacher Dr. sir for teaching us anatomy so wonderfully well. We are starting with the muscles of mastication now. Muscles of mastication is a very important long note for all the BDS first year students and of course for the MDS first year basic sciences paper, and a very important question for the NEET examination as well. Muscles of mastication. Mastication means to chew. Mastication means to chew. Muscles which are used to chew the food are known as muscles of mastication. So muscles of mastication are the muscles used to chew the food. We have four muscles of mastication. Number one is masseter muscle. Number two is temporalis muscle. Number three is lateral pterygoid. And number four is medial pterygoid. So we have four muscles of mastication. Number one is masseter. Number two is temporalis. Number three is lateral pterygoid. Number four is medial pterygoid. You have to understand here that we have four important common points in all the muscles of mastication. Number one is all the muscles of mastication are derived from the mesoderm of first pharyngeal arch. All the muscles of mastication are derived from the mesoderm of first pharyngeal arch. All the muscles are supplied by mandibular nerve. All the muscles of mastication are supplied by mandibular nerve. All the muscles of mastication are inserted into the ramus of the mandible. All the muscles of mastication are inserted into the ramus of the mandible. All the muscles of mastication moves mandible only. All the muscle of mastication moves mandible only. So we have to understand whenever we have to write the long note, we start with all these 4 points that they are the derivatives of the mesoderm of first pharyngeal arch. They all are supplied by mandibular nerve. They all insert into ramus of the mandible and they all move the mandible only. We all know muscles of mastication, they get inserted into the ramus of the mandible. So we should know what is a mandible, what is the ramus of the mandible. Mandible is a jawbone, lower jawbone. The word mandible is derived from a Latin word mandibula or mandare, which means to chew. Word mandible is derived from Latin word mandibula or mandare, which means to chew. That means the jawbone which is used to chew is a mandible. So mandible is a horseshoe shaped bone. Horseshoe is like this, we all know this, and is used in many Indian families for good luck. So horseshoe shaped bone is a mandible, and mandible is the largest and the strongest bone of the face. So mandible has a body. This B stands for body. Mandible has ramus, R stands for ramus, and mandible has an angle which is known as gonial angle. Body means any part of a person which doesn't contain head, neck, arms or legs is a body. So main component of the mandible is a body. Then we have a ramus. Singular is ramus, plural is rami. So ramus means projection, ramus means extension, ramus means segment. So segment or extension or projection of the body or the mandible is the ramus. And the area or a junction where body and ramus meet is known as angle, which is known as gonial angle. And angle means where 2 points or 2 lines meet but never in a straight line, at an angle. So now ramus has a condyle and also has a coronate process. So ramus is the part of the mandible which has a condyle and a coronate process. We all should understand what is mesial surface, what is lateral surface of any body, any part of the body when we learn anatomy. So lateral means, so always draw a line in the center of any part of the body. For example, this central line. The area which is near to the central line is medial or mesial. Area which is away from the central line is lateral. So the outer surface of the mandible is lateral surface because it is away from the midline, and the inner surface is mesial surface or medial surface.